Is snoring normal? Of course, that's the topic we are going to discuss today. Snoring could be normal, but if the snoring affects others, like patients who come here and say, my wife and children, they don't sleep with me, they go to a different room. And recently I went to a batch meet. None of my friends like to share the room with me because of my snoring. Then it becomes abnormal. Then it could be sleep apnea or obstructive sleep apnea, OSA, especially if you're obese and you're not able to lose weight, if your sugar is it's not able to control your sugar, and your BP is not under control. All these things with the snoring could be abnormal. It could be sleep apnea. uh, what is snoring? Generally, the air enters through our upper aerodigestive tract. So when we gain weight, the fat deposits, and there could be a narrowing of the air passage, causing whistling sound. Second, the hard palate from soft palate. The where your soft tissues tangling. That area is called soft palate. When we are sleeping, that vibrates because of the weight and narrow passage that can vibrate. That is the snoring. The third is, suppose somebody is obese, overweight, and they're lying flat because of the abdomen weight. The diaphragm is elevated, so the air entry will be restricted. So when the air entry is restricted, the oxygen levels drops down, carbon dioxide level increases. So disturbing is sleep. They'll have a dream, kind of sleep, light plain sleep. So what usually they do is, usually they, from one pillow to second pillow, three pillows, they increase their number of pillows. They can sleep only on the left lateral side. Third, probably they wake up frequently. In between, they take deep breath, and they'll be sleeping, snoring for some time. Then they stop snoring, take a deep breath, then sleep for a few seconds. Again, they'll wake up. So the sleep disturbance will be there. So they have a mouth breathing. So they keep taking water in the middle of sleep. They wake up and thinking they are dry, they are thirsty. So they keep drinking water because they pass a lot of urine. So the sleep is disturbed. That the moment they wake up the next day, they feel tired, they are not relaxed. They may have a daytime sleep, especially if you're driving, sitting in a chair in the office or waiting for somebody, they can easily fall asleep. Or when they go to the movies, they sleep very fast. So these are, with snoring, could be sleep apnea. This is abnormal. So apart from the one pillow, two pillow, three pillow, sleeping on the other side, they're not able to control their sugar. They're not able to control their hypertension. They gain weight. The sugar is erratic, and the quality of life and quality of work is disturbed. Along with, suppose they have a short neck, or the neck circumference, the Adam's apple level, if it is more than 40 centimeter or more than 16 inches, probably definitely they have a sleep apnea. So generally, the oxygen level is low, carbon dioxide is high, so it will not allow the brain to sleep. So this keeps, it's like a vicious cycle. Because of the weight sleep apnea, because of the sleep apnea, they gain weight, and because of that, metabolic syndrome. So how to diagnose is very simple. First, the doctor, the physician will examine you, then probably will ask some questions, and then order for a sleep study, polysomnography, either in the home or in the lab. Even the home study is more than sufficient to diagnose it. So that will show what is your saturation level, how low the saturation goes, what is the apneic smell. Apneic smell means you don't breathe at all. So what is the apneic smell? So they will give a AH index. So these are all the numbers they come with. That the physician will come to a conclusion, probably you have a sleep apnea. So sleep apnea, the treatment part, first is weight reduction, lifestyle changes, and weight reduction. And because of the sleep apnea, most of the people will depend on alcohol for the good sleep, or they depend on medicines for the good sleep. So first is weight reduction, lifestyle changes, metabolic syndrome control, like diabetes control, hypertension control. All these things very important. And some people may require positive airway pressure, ventilation. So they'll have a small machine that supplies, under pressure, air. during the sleep, so they can have a good sleep. This is one part. And beyond that, most of the people with obstructive sleep apnea, they may require weight reduction, surgical weight reduction, like bariatric surgery. So if you're having snoring, disturbing others, and your obesity, uncontrolled diabetes, hypertension, and you're not able to lose weight, probably consult your doctor. Probably you may have a sleep apnea and get it treated. Thank you.